Okay.
All right, let's go through this.
Starting with the question at the bottom, which of the following is a known teratogenic effect associated with the use of alkylating agents during pregnancy? So that's kind of a memorization, and I believe it's anencephaly. We can go through the question and see if it gives
Sure.
me any other clues. She has an aggressive form of lymphoma during her second trimester, started on chemotherapy that includes an alkylating agent. Patient is concerned about potential teratogenic effects. Okay, so not really any extra information there.
Sure. Final answer?
Final answer.
Okay, perfect. Okay, so
Ah,
this is gonna be a tough one, right? This is a memorization one. There's not too much logic,
yeah.
right? So, in a sense, right, I like exactly how you work through this question. I know that sounds weird, even though you get it wrong, right? Getting it right or wrong is not necessarily always, there are other things that you want to focus on also about doing a
Mhm.
question. So understanding this question is memorization. So you kind of pick the best answer choice and move on, right? Whether it's right or
Yeah.
wrong. Sometimes you know it and or you don't know it, right? And so no use to spending, 10, 15 minutes on this question when the result is either you know or you don't, right? So in this
Yeah.
particular, alkylating agents, right? It's going to be intrauterine growth restriction. Did I remember that personally? No, I didn't remember that personally, right? But anencephaly, right, is usually going to be folic acid issues. Okay.
Okay.
And so what affects folic acid in pregnancy is going to be your valproic acid and carbamazepine, your seizure drugs is going to give you
Okay.
anencephaly. Okay. And then cleft lip and palate, right? You can get it with phenytoin or isoretinoin if you're talking about teratogenic effects, limb defects, right?
Mhm.
The flipper, right?
Yes.
Flipper babies, the
Thalidomide.
thalidomide, exactly. Neurotube defects, right? Is going to be in kind of the same, kind of same category of teratogenic effects of anencephaly is going to be your issues with folic deficiency. So that's
Okay.
how, I don't know, you kind of can work
Okay.
through it.
I think
Hopefully
that
that
kind of
can,
makes sense with the anencephaly being with the seizure drugs. You can almost remember that as like, seizure activity in your brain. So mom's
sure.
taking a drug for her brain and it affects baby's brain.
Yeah, you can definitely remember that. Definitely seizures come from the brain, and if you take, seizure medications, then it can affect baby's brain, which ironically speaking, that actually have, that logic that you're speaking of, occurs with a lot of teratogenic effects. So if you take blood pressure medications that work on the
Mhm.
kidney, then it affects the kidneys of the baby, right?
Okay.
That's something you can remember. I
Yeah,
think
like ACE inhibitors.
exactly. If you take ACE inhibitors, no bueno for kidneys for baby. Um,
Yeah.
but yeah.